Welcome to this explainer. Today, we're mapping out a truly fascinating, honestly kind of delicate clinical procedure, the insertion of a nasogastric tube. Now, on the surface, a clinical protocol like this might just look like a dry list of instructions, right? But when you really look closely at the details, it reads almost like a treasure map for navigating this hidden biological obstacle course. We're going to break down this exact physical journey today, step by step, relying entirely on the precision outlined in the actual clinical protocol. Okay, let's dive into this. How exactly do you safely guide a flexible tube 10 full inches into the human body when you literally can't even see where it's going? Think about that challenge for a second. You've got no camera, absolutely no direct line of sight. You have to rely entirely on specific physical cues, anatomical landmarks, and, as we'll see, patient cooperation. So we're going to treat this clinical checklist like a real-time journey through this anatomical obstacle course, looking at the exact mechanics of how a practitioner actually feels their way to success. Just look at this specific navigational instruction pulled directly from the protocol. Aim back and down toward ear. I absolutely love this because, well, it's not just a dry, abstract medical directive. It is incredibly tactile. It's sensory. You can almost feel the angle as you read it out loud. As a practitioner, your hands have to deeply understand this precise geometry to safely begin the journey. It tells you exactly how to position your body in relation to the patient's anatomy just to make that first critical move. Section 1. Preparation and initial insertion. Setting up for success. Setting up for success here is entirely about establishing a safe, completely frictionless environment before the tube even comes close to the patient. Before anything else happens, the protocol mandates strict hygiene. Step 1, perform hand hygiene and apply clean gloves. Crucial, right? Once your hands are safely prepped, you address the physical friction of the tube itself. Step 2, you take the tube, which has this special surface lubricant on it, and dip it directly into a glass of water. Imagine the physical feel of that action, activating that slick, lubricated surface with the water so it's perfectly primed to just glide smoothly through incredibly delicate internal tissue. Okay, so the first major anatomical milestone on our route is the posterior nasopharynx. The protocol defines this simply as the back of the throat, which you access by inserting the tube straight through the nostril. This is the exact physical location where the tube meets its first real juncture inside the body. It's really where your physical navigation as a practitioner kicks in and becomes highly intentional. Now, what's really interesting about this slide is that it brings us right back to that crucial angle we looked at a minute ago. When you hit that posterior nasopharynx, you don't push up into the nasal cavity. Nope. You execute that specific spatial command. Aim back and down toward ear. That precise vector is the vital navigational key to safely unlocking the nasopharynx and making sure the tube enters the throat smoothly. Section 2. Swallowing and navigating. The patient partnership. Let's move to and see how this builds, because at this stage of the obstacle course, the practitioner literally cannot do it alone anymore. It turns into this vital, highly coordinated physical dance between the healthcare provider and the patient. The clinical protocol explicitly outlines the patient's active, mechanical responsibilities in this process. First, once the tube has passed through the nasopharynx, the patient must flex their head down toward their chest. Then they're actively encouraged to sip water or ice chips, to continuously swallow, and the protocol emphasizes the strongly to mouth breathe. The actual physical mechanics of flexing the head and swallowing those ice chips literally shape the internal pathway. It actively guides the tube down the exact right anatomical tunnel. And here is where the partnership reaches absolute peak synchronization. The protocol directs the practitioner to advance tube as patient swallows. You have to move your hands in perfect harmony with the patient's internal muscular actions. It's fascinating. Every time the patient swallows, the pathway safely opens up, allowing the practitioner to glide that lubricated tube forward, step by step, swallow by swallow. Section 3. Checking and final positioning. This safety stop. We are now deep inside the patient's body in the high-stakes phase of this obstacle course. The major milestone we're watching for here is the carina. According to the protocol, during insertion, the tip of the tube eventually reaches this internal anatomical landmark. This is the critical juncture. It's our ultimate safety stop where you absolutely must pause and execute a vital check just to ensure the tube is actually on the correct path. And how far down into the body is this landmark? Well, the protocol notes that reaching the carina is a distance of about 25 centimeters or 10 full inches in an adult. Think about the sheer scale of that measurement for a second. That's almost a foot. You have navigated a flexible, lubricated tube 10 inches deep down an invisible pathway, relying entirely on touch, precise angles, and the rhythm of the patient's swallows. No small feat. So, at 10 inches deep into this unseen space, we face an incredibly tense question. How do we actually know where the tip of the tube is, right? We need to be absolutely certain of its location for the safety of the patient. Without being able to see inside the body at all, what exact physical cue does the protocol give us to check our work? So the crucial point is right here in the text. You stop, hold end of tube near ear, and listen for air exchange from distal portion of tube. This is really the sensory climax of the procedure. You completely shift your focus from the tactile feedback in your hands to auditory feedback. You physically hold the outside end of that tube right up to your ear. If you listen and hear air exchanging, well, that's an immediate critical signal about the tube's internal placement. It's a brilliantly simple, vital safety check using nothing but human senses to navigate complex human anatomy. Once that safety check is cleared, the procedure resumes. And this brilliantly illustrates the final rhythm of the protocol. It becomes a steady, repetitive loop to finish the journey. Step 1, wait for the patient to swallow. Step 2, advance the tube. Step 3, repeat this exact cycle every single time the patient swallows until the desired length has been passed. This careful, pulsing rhythm brings the tube safely to its final destination.
Which leaves us with this final remarkable thought. Why is the rhythm of the patient's swallow the ultimate key to unlocking this entire physical obstacle course? Well, it shows us that even in a highly technical, rigidly structured clinical protocol, success isn't just about the isolated skill of the practitioner. It relies fundamentally on the active, synchronized mechanical partnership of the patient's own body. Think about that delicate balance the next time you consider the fascinating mechanics of clinical care. Thanks so much for joining me for this explainer, and keep seeking out the incredible structures behind the skills.